Hello, namaste everyone. I'm Dr. Sunil Richardson. I'm a maxillofacial surgeon who's been trained extensively on the face for the last couple of decades and more now. And today I'm going to talk to you something very, very essential, very, very at the heart of facial surgery. Many patients come to me and want many different kind of procedures done on their faces. They would want to change the shape of the nose, shape of the chin, augment the upper jaw, so on and so forth. I mean, so many multiple requests people have. And I think at this point, I would want to tell my viewers, I would want to tell the audience, I would want to tell the patients who are seeking these kind of facial improvements, facial augmentative, facial cosmetic surgeries to just understand what is the philosophy behind all of this. Now, as far as I'm concerned, I think facial aesthetics is a little bit deep rooted, and I would base it on three very strong pillars. The first of it, I would call it as a function. You all know our face, which is from the hairline till the Adam's apple and between the ears, has lot of function. The function of sight. The eyelids have the function of closing and opening to protect the eyes. The nose has a function of breathing for smell. Teeth, chewing, jaws opening, so on and so forth, speaking, speech, everything. So what I'm trying to say is function is a very, very important aspect in facial cosmetic surgery, facial plastic surgery, any kind of facial surgery. What are the other two pillars? The other one is proportions. Now, I think you already have heard a lot about golden proportions, golden ratio, what a proportion does to aesthetics, how the nose should be proportional to the face, how the length of the face is proportional to the width, how the width of the eyes is proportional to that of the mouth, how the length of the teeth is proportional for your smile. There are a million proportions that we have on the face. These proportions are very, very essential, and I would call it as the second most strongest pillar that we consider when a patient comes to us for facial aesthetic, facial augmentative, facial beautifying surgeries. Now, what is the third pillar then? The third pillar is the symmetry or the asymmetry. Now, the face looks more attractive when it's symmetrical. Having said this, a little bit of asymmetry, one dimple on one side when you smile, sometimes or oftentimes actually enhances beauty. So you have to keep in mind that symmetry is important, but in a lot of patients, proportions maybe are more important than symmetry. But anyways, symmetry is another thing that I would take care of before and during we plan and execute a facial plastic surgery. Now, going on to the three pillars, once again, trying to summarize what it means. So if a patient comes to us who has issues with breathing, and he would want to get the way his nose looks altered, we would now consider him maybe a septoplasty, maybe an internal wall augmentation, whatever that is, the functional aspect of that nose, that's more important than the way the nose looks as well. So both of these are going to be in consideration while we plan and execute, but I keep function as the number one most important factor for facial aesthetics or facial surgery. Number two is proportions, and again I'm saying the number three is asymmetry. When a patient comes to us with a post-traumatic deformity, with a deformity that's out of birth, like a congenital issue with a cleft, or with any of the post-traumatic, post-oncologic, after cancer surgery resection, these patients, symmetry is more important than proportion. Obviously, function is the most important aspect. So it's a very, very intricate web of how various facial aesthetic subunits are stitched together, are intermingling, and how these three fundamental pillars of facial aesthetics work. So therefore, when a patient comes to us with, let's say, a sleep apnea, they're finding difficult to sleep, yes, we would also look at how this surgery is going to make them more proportional, make them more appealing, more confident, more beautiful, but we're also mainly going to address the issues of not being able to sleep. So my expertise of being a craniofacial surgeon, being a maxillofacial hard, bony work surgeon, to having an extensive work on the soft tissues of the face, gives me and our team the unique ability to be able to handle a lot of these things on the face. You can have a look at thousands of videos that we've published over the years on YouTube and other areas. This, do remember, is a very, very small fraction of the actual work we do. We have an absolute fantastic team working with us here. I keep liking to tell this, I keep saying this again and again, and each and every member of a team, if not, is as good as me, it's only better. So you're going to be in hands of a team that knows what we're doing. We have a strong set of values, strong set of philosophy. And I think the patient, when you seek for these kind of procedures, must also have an understanding and even a philosophical background, so that when the procedure is done and the recovery is there happening, you are a satisfied patient. You're really happy for what has been done. And we are also very happy to be able to give that care. Now, as usual, we're going to come back to you in the few more videos. I'm going to tell you about the different aesthetic subunits of the face. And I'm also going to tell you how these aesthetic subunits are going to improve, alter our final facial aesthetics. Do follow our channel. Let us know if you have any questions. Shoot them down below, and we'll be more than happy. Our team will be more than happy to answer them out to you. And if you have anything else more, do let us know. Thank you. Bye-bye.